Welcome to CareAlign, a task management, document automation, and data visualization platform. Our task module and note generator streamline work that is often done on paper or in other unstructured formats to reduce duplicative work and enable providers to focus on more patient care than administrative tasks. In this example, we're going to focus on Mrs. Smith, a 58-year-old patient with a history of poorly controlled diabetes, coronary artery disease, and GERD. Mrs. Smith was recently admitted to the hospital with pneumonia, then transferred to a SNF after experiencing a GI bleed. She's now at home. Mrs. Smith's family recently called Dr. Johnson, their primary care provider, to give an update on her hospitalization and to set up a follow-up appointment. During that call, they spoke to the on-call nurse, Nurse Megan, who was able to make updates to the care plan. This is CareAlign. Notice that the on-call nurse can see the patient demographic information and a one-line summary, which is the assessment of the SOAP note. She can use this second data box for any additional notes. The subjective box is where Dr. Johnson will put the S and the O, the subjective and objective, of her SOAP note, all of which can clearly be seen by everyone. After this, the main part of the screen is organized by problem or issue. This is the plan of the SOAP note. During the call, Nurse Megan was able to add updates from the call to the patient's plan, including tasks to make sure the necessary follow-up questions are addressed, and most importantly, to make sure that nothing falls through the cracks. As you can see, Nurse Megan created new issues on the plan for Mrs. Smith's recent admission. When Dr. Johnson logs in, she can see that GERD has been updated to reflect that Mrs. Smith had a GI bleed during her admission. It was noted here by the nurse that aspirin was held during the hospital admission because of the GI bleed. Dr. Johnson can easily see this because Nurse Megan flagged it as an FYI and colored it yellow, helping ensure she does not miss this important step. Mrs. Smith's chronic issues, coronary artery disease and diabetes, are both on the plan as well. As you can see, both of these problems have background information stored as historical, which means they're always accessible but hidden to make sure the plan is uncluttered and easy to read. As we all know, social determinants of health are incredibly important to keep track of for patients. So Dr. Johnson has created a template she can add to any patient plan, ensuring the entire team has a readily accessible place to keep track of and always update a patient's social issues that can affect their health. Bundles or care templates are completely customizable and can be shared with others in your practice. They can be completed by anyone, for example a triage nurse or coordinator, and do not have to be completed by a physician. During the visit, Dr. Johnson can quickly see all of the tasks she created in the to-do view. She can update a task, check it as done, or create a new follow-up task as she speaks to Mrs. Smith. Once the visit is complete, Dr. Johnson uses the information she created in CareAlign to create her note and place it into the EHR. In addition to task management and easy documentation, CareAlign's data visualization module unlocks the power of interoperability by bringing patient clinical data into the plan, giving providers two-click access to the most recent labs, vitals, and studies. Labs and vitals are aggregated into intuitive trend lines and fishbone graphs. You can quickly find the results of a study by searching here, which reduces unnecessary duplicative tests. Medication lists are also easily accessible here as well. CareAlign's task management, documentation, and data visualization modules integrate with any EHR and are available on any internet-connected device from anywhere, helping clinicians reach their goal of making fewer clicks and providing more and better care.